يواصل فيروس الكورونا تمدده حول العالم، حاصدا أرواح الآلاف من الأشخاص. حصيلة المصابين بالفيروس في الولايات المتحدة وصل إلى ما يقارب 614 ألف حالة، وحصيلة الوفيات وصلت إلى 29681. أما في ميشيغان فحصيلة الإصابات هي 27,000 وعدد الوفيات هن 1768. اليوم حلقة خاصة وهي تغطية لآخر مستجدات فيروس الكورونا. رح تكون مع دكتور بلال عبدالله واللي هو أخصائي بالطب الباطني، وأيضا معنا دكتور شادي حداد واللي هو الطبيب نسائي وتوليد، وأكيد رح يخبرنا شو لازم تعرف النساء الحوامل عن الكوفيد 19 وما مدى تأثير الكوفيد 19 على الحمل. وأيضا معنا حامل أصيبت بفيروس الكورونا الأسبوع الماضي، واليوم هي معنا لتشارك بقصة أو تجربتها مع الكوفيد 19. مساء الخير لكل مشاهدي واتساب ميديا نتورك. بيسعدني يكون معكم اليوم، وبيسعدني أيضا أنه رحب بأسئلتكم وتعليقاتكم عبر واتساب ميديا نتورك فيسبوك لايف. فخليكم معنا. الحلقة اليوم رح تكون بالإنجليش مع الدكتورز ومع البيشنتس. Join me tonight, internal medicine specialist and chief medical officer for long time care at Beaumont Hospital Dr. Belal Abdallah to talk about the latest update on the coronavirus. And also we have Dr. Chadi Haddad. He's an OBGYN doctor, and he wants to tell us what women or pregnant women should know about COVID-19 and the effect of COVID-19 on pregnancy. And also we have Sandra Ramos. She happens to be pregnant, and she got sick with COVID-19 last week, and she's here to share with us her experience. So stay with us. Hello, doctors. Hello, everyone.
Hello.
I hope you are doing well.
Yes.
I'm going to start with Dr. Bilal. It's good to have you tonight with us. And I'm going to ask you, we have like a big number of cases and deaths in Michigan, particularly. So why do you think this has happened so quickly? Was it maybe the slow response from our president, or it could be the precaution of Americans basically not following protocol? What do you think about that?
Thank you for having me. You can hear me okay?
Yes, now I'm okay.
Great. That's a great question. It's a very complicated question and intriguing. So there are several factors as to why we here in the United States were poorly prepared for this virus, as well as this was like the perfect storm for a pandemic to occur. So let me just go back historically what happened. So the first patient that we have now found with the COVID-19 infection goes way back to November of 2019 in China. And this patient, of course, nobody knew about because it was one patient got infected, and we now know that it came from a bat. So in China, no one really paid attention to this patient. But by the time they started to notice that more and more people are getting infected, it was already in December 27th of 2019 when the Chinese realized, hey, there's something really going on. But by that time, there were 180 people infected in Wuhan, China. And at that time, they didn't realize that the transmission was from human to human. They felt that there was still confined to this small group that somehow were either exposed to bats or they call them wet labs, where there's wildlife that they were selling to China. So it wasn't until mid-January of 2020 that the Chinese understood that there was human-to-human transmission, and the World Health Organization really didn't announce that there was human-to-human transmission until mid-January.
Correct.
Right around that time was the first patient that came to the United States with the infection. So the United States was already including the president, the federal government, really looking at it as it's not going to transmit human to human. We can contain it, but it's too late in mid-January when the first patient first arrived in Seattle, Washington. Not only that, now another part of this perfect storm was in December, it was the Chinese New Year. So with the Chinese New Year, Chinese start traveling all over China and all over the world. So many Chinese, during the time that some of these patients were getting infected, started traveling throughout the world, including early on, many Chinese Muslims traveled to Qom, Iran, where, as you know, was another large epicenter early on.
So that contributed a lot to it, for sure. Yes.
Yes. And in Qom, they were paying homage to a religious site, and over there was a large spread, as you know. So all of that together kind of formed the perfect storm. Now, whether we were prepared in the United States, well, as you know, for many decades, different presidents have always come on stage and said, you know, one of the worst things that can happen to the United States is not a nuclear war, but a pandemic. And we've always heard that, but we've never really done anything about it. You just hear every president say we need to be prepared, but we never did prepare.
We never got prepared. Is that what you're saying?
We were not prepared.
Okay.
So we did not have the personal protection equipment that's required of a pandemic. We did not plan for enough ventilators that will occur with a pandemic. So we were not prepared as a country. So everything put together really put us in a bad situation right now.
Yeah. So what you're saying, it's probably a combination of both.
Correct.
Kind
like,
of. Yeah.
What do
you think, Dr. Chadi?
My thoughts are, a lot of information is still coming. I agree with Dr. Bilal on a lot of things, but today, the information is very fluid. So every day there is something new. One thing I just read today that the wet market does not have bats. In the wet market, they do not have bats. So there is information that, we're throwing on, the information on that the spread started over there, but there is a lot of questions and we don't have a lot of answers yet. And it's going to be a while before we get some answers. I think we were not prepared, that's for sure. And every scientific person and every president have discussed the pandemic that it could hit the US or the world, and we were not prepared. We're prepared on other fronts, war, missiles, and all that, but for a healthcare to get protection, I don't think we have enough to deal with the pandemic. I think now we're a little bit better, right, Dr. Bilal? We're catching up, but I think we're doing a little bit better.
So, Dr. Bilal, will the strain on our healthcare professionals to be continued an obstacle? To be an obstacle on the nation of fighting COVID-19?
Yeah. So when it comes to healthcare workers, in general, I think the first thing that we need to do, and we are doing right now as a country, is to mitigate the infection. So by mitigating the infection means we're trying to reduce the amount of new infections that occur every day, flattening the curve. Yep. So the things that are in place, as you know, the shelter-in-place orders and social distancing are the way to do that. So we've already gotten the first offensive by the virus. We got affected. Everyone got infected, or not everyone. Many people got infected, and we suffered the consequences of that. However, I can say that with the shelters in place, especially here in Michigan, we have now reached a point where now it's been exactly or a little over 2 weeks since the full shelter in place took effect. And I was just looking at a chart today, and we are starting to notice that the peak, we've reached the peak, and it's starting to come down to flatten that curve. Although you're going to see some spikes, it's not going to be every day. You're going to see the same amount, but we've been able to flatten the curve. When it comes to healthcare workers, as long as we can protect each and every healthcare worker with N95 masks, the full gear, the hazmat suits, the N95 masks, the goggles, the shoe covers.
Doctor, as a doctor, you've been practicing for over maybe 27 years. You've been practicing medicine.
Yeah.
There was a protest in Lansing today. What do you think about that? What do you think about the protest?
From the healthcare workers?
Yes.
Yeah. I mean, I can identify with them. You know, when it's like being put in the trenches in a war as a soldier without proper equipment, and you're just there, and the enemy is shooting at you.
Yeah.
This is exactly what healthcare workers feel when they're put on the front lines. You know, we have to go out every day. We cannot say no to treating patients.
Okay.
If you go out there and you're at risk, that's been the biggest, unfortunately, the biggest barrier that's happened to healthcare workers. You know, and when you see doctors die, I've seen a resident who 14 years of training, in his 6th year, he's ready to graduate, and he dies from this. It's just so sad.
Yeah.
So,
Yeah, I think she's asking about the protest today regarding people want less restrictions. Is that correct?
oh, those protests.
Yeah.
I guess there is two of them.
Yes. So on that side, yes. From that, okay. So we flattened the curve. We've been able to do that. I think now after this first wave, people now understand what social distancing is. You can, as long as when you go and interact in public, you're at least 6 feet away from others, and you practice good hygiene. You wash your hands thoroughly. You don't touch your face if you don't have washed hands, and you wear a mask in public. I think if we're able to do those things, the government can start to loosen up on the restrictions. But if we're not able to do those things, we're going to go back to square one. We're going to see
It is too early to do that, for sure.
it is too early.
Okay.
Yeah.
So I'm going to say hi to Sandra. How are you tonight?
Hi, fine.
Thank you for being here. You agreed to tell your story tonight, and I know on April 11, on Saturday morning at 5 a.m., you went to the hospital and you stayed for a few hours, and by 9 a.m., you went back home knowing that you have COVID-19.
Yeah.
Tell us the story. What happened? What did you have? Tell us about the symptoms. And why did you go to the hospital?
I felt like I was sleeping. I felt like I couldn't breathe, like it was something blocking my throat, my airway. And I was hot, just like irritable. So when I got to the hospital, they did say I had a little bit of a temp, and they kept me in the morning for a few hours. And then that's when they told me that they tested me and it came back positive.
Okay. So were you feeling the pain? I mean, what else did you feel besides that?
Prior to that, I want to say a few days, like maybe Thursday night, my throat was really itchy. I noticed it being really itchy, and my sinuses, like I was sneezing. I just thought it was my allergies.
Okay. Well, I'm going to ask you, Dr. Chadi, if I want to ask you about the healthcare professionals or officials, they say that, whoever is, I don't know how to say it anymore, like elderly and the people that, they have symptoms and stuff like that. The elderly people usually. Pregnant women have questions, have concerns.
The question is very broad, but
what do you know about the pre-existing, the people that have pre-existing, conditions? They have more complications with COVID-19.
So we don't have a lot of information about people who are pregnant and what kind of symptoms they're having, right? We just have a little bit of information that is coming out. But we have seen the same symptoms in elderly people, in young people, and in pregnant women. Shortness of breath, headache, chest tightness, cough, sore throat, diarrhea. What have we seen? Skin changes. I mean, the symptoms are so broad. Like, it's just amazing. Today, I just delivered the lady. She came in. She had a little bit of nausea 2 days ago. So we did some testing thinking she has a gallbladder problem. Her enzymes that are related to her gallbladder were elevated. Okay? I said, test her for COVID. She comes back positive for COVID. Nobody would have thought that a little bit of nausea, will end up being a COVID patient. And now we have to worry about 2 more people, the dad that is present in the room and the baby.
Okay.
All right. So the questions are a lot. Like, what are the risks? Is the patient gonna get sicker? everybody is different, but what we have seen so far that most young people are doing well. There is a concern that women in the past, when they get infected with flu, the usually outcome is worse. Respiratory problems, because the baby is pushing on the diaphragm, makes the breathing even worse. Sandra, she's very early in her pregnancy, so she's probably not having that issue. So the question is a lot. Now the question, we'll talk more about other issues.
The risk of miscarriage having COVID-19.
So far, there is no information about increasing risk of miscarriage. What happened is, in the beginning of the pregnancy, you have like inflammatory process, so the placenta can attach to the uterus and the baby can grow. And then you're as a pregnant lady, you kind of decrease your immunity. Those are two concerning issues in a pregnant lady. But luckily, we have not seen the bad side effect where the mom yet has to be on a respirator, or she's having those severe cases like the elderly people. So far, we have seen the adult ladies are doing very well. A lot of them today, I heard about 2 patients, they have no symptoms whatsoever because we're testing everybody. They came back positive. One was scheduled for a regular C-section and one was in labor. No symptoms.
So can they pass it to the fetus?
Well, the virus does not go to the fetus. What we worry about is, so in the body fluid, there is, when the lady delivered, amniotic fluid, there is no virus. We tested that and it doesn't seem to be happening. What we worry about is after the baby delivers, if the baby is going to stay close to mom, what do we need to do? We're kind of doing social distancing between the mom and the baby.
Yeah, but how, if she wants to breastfeed the baby, how can she breastfeed the baby?
So she has to wear a mask.
Okay.
And she has to clean the area. And she has to wash her hands. So no virus on the hands or on the breast can be transmitted to the baby, or through the cough if she's sneezing or coughing, etc. That's why the mask. And that's the recommendation. But tomorrow I might be wrong. They might come up with a different recommendation. Right, Dr. Bilal?
So far, there's no indication that she will pass, COVID-19 to the baby if she breastfeed the baby. Is that what you're saying?
I'm sorry. I think I lost the volume. Can you hear me?
Yeah, we can hear you for sure. I'm gonna go to Dr.
Testing.
Yes.
We'll come back. I'll try to fix it.
I'm going to ask you, Dr. Bilal, we know by now, washing hands are very necessary not to spread the virus, but are soaps created equally? And if not, what are the best ones to use for now?
Yeah, so when it comes to hand washing, all soaps are created equally. So you can use any hand soap. You can use even dishwashing detergent to wash your hands. The key to hand washing is to really rub your hands for 20 seconds together, and get into your nails and really rub them good, and get that soap in there, and then you can rinse. It doesn't matter what temperature; you're still going to kill the virus. If you're going to use a hand sanitizer, it has to be 60% alcohol based. So make sure you get the hand sanitizer ingredients and it's 60% alcohol based. And then when you rub your hand with a hand sanitizer, make sure that you completely rub them until they're dry from the sanitizer. And that's when you know that you killed the virus.
Okay, I'm going to ask you about the masks right now, the N95. When the pandemic was unfolding, we were told that, masks, we don't have to really use masks. Why are they necessary now to wear?
Yeah, so that's been, I think, another area where we were unprepared for this virus. So initially, the CDC was recommending do not wear a mask if you're healthy, if you're not infected, and wear the mask only if you are infected. But now what we've learned is that the virus can even when somebody's breathing that has the virus, and there are people that are asymptomatic and they can be breathing, and they're breathing out the particles, the microparticles with the virus in them, and they can be in the air for as long as 15 minutes. So if you're in an enclosed place, like a grocery store, for example, or a pharmacy or a bank, those microparticles could be in the air. And if you're not wearing a mask, you can inhale those particles, and the virus could cause infection.
Okay. Well, yes, we have a question for Dr. Chadi. It says, can you please talk about doctor visits for pregnant women in women who are scared to deliver because of the virus?
All right. So, a lot of information we're giving is the same thing that goes for everybody. So now what we're doing, we're having patients wait in the car, and we have them come in. Okay, when they're ready or when we're ready for them, we'll call them in. If there is people in the waiting room, we're usually separating them. They have to be 6 feet apart. We recommend that people come with a mask because we're seeing a lot of people who have no symptoms, but they have the coronavirus. Okay, so then they go into the room. We have to use, we are wearing masks. We are wearing gloves. The patient, hopefully they have masks. I mean, we can't provide masks for every single patient that comes in. And we're just using the same precaution. They shouldn't be scared. I mean, I'm sure they go to see, to go to their food store to get food. It's the same thing. They have to take care of that baby. And Sandra knows you have to come in for your appointments. So, yeah, it's the same precautions that we're asking for everybody. I mean, people are going to listen to us and to the radio and to the TV. And things are really scary when you have so much information. But really, if you look at the numbers, out of 10 million people in Michigan, it's okay. We can handle these numbers. I think the future is going to be where we're going to be tracking people a little bit better and know who's sick and who's not. But for now, we have to take care of these patients. They have to be taken care of. They need that ultrasound. They need that lab work. They shouldn't be scared. Just use the same precaution. Make your visit very short. Don't spend too much time there. We can answer a lot of questions on the phone. Like I give my patients sometimes my cell phone. They can call if they have questions. They don't need to come in and expose themselves. So these things we're doing right now, hopefully as the numbers go down, we're able to, be a little bit more free about movement and maybe seeing the doctor, not like it used to be. It's going to be a while.
Yeah, but these women can't help but being scared. They're caring for 2 people, not 1. So
call me and I'll make you feel better.
Yeah, and you make them up as well.
Okay. Luckily, a lot of patients are doing very well. A person from a family member, if something bad happened, that's a tragedy. When you look at the whole population, it becomes a statistics. And we are really caring about for those patients that are going to be a tragedy because they're close to us. Every life matters. And that's the difference that, we're trying to make. We're trying to save people from, dying. And those little numbers that are, unfortunately not doing very well, we're trying to help them out. But the rest of them, they do very well. Like Sandra, I mean, you can't tell that she has COVID, can you?
She seems like she's doing well tonight.
Yeah.
Right, Sandra?
Yes, I'm doing good.
You're still feeling
You have a couple of good doctors, huh?
And you're enjoying the conversation, obviously. This is something that, you should listen to. I mean, at the moment, right?
Yes.
Yes. Dr. Bilal, Michael Dowling, the CEO of Northwell Health, says if you go on ventilator, there's about 20% chance that you will survive. Why do patients who are put on ventilators have low rates of survival?
Yeah, that's a good question. Let me first say that 80% of people who get infected with COVID-19 will do well. Mild symptoms, stay at home, quarantine, 14 days, and they do well. The other 20%, this is before we get to the ventilator, the other 20% are the ones that have comorbidities like asthma, hypertension, congestive heart failure, COPD, diabetes. Those patients don't do so well. They might get a moderate illness. And then of those patients, they may end up on a respirator, on a ventilator. So what happens in those patients is, when the infection first enters your body, it has an inclination to go to your lung cells. And that's where it likes to infect the most. Although now we've seen that it's in many other parts of the body as well. But the lung cells are the most important part that this virus likes to infect. And what happens is your immune system prepares to fight back. And as it prepares, sometimes what it does, it over prepares.
Okay. Would patients be able to go back to normal though after the whole?
Yeah. So I want to tell you. So what happens is they get this over reactive immune response and we call it a cytokine storm because it's a storm of inflammation. And that causes someone to go into acute respiratory distress syndrome, where that's a condition where you have a lot of inflammation around your lungs, and it makes you feel like you're drowning and you can't breathe, you can't maintain your oxygen. So it's at that point that those patients need to be on a ventilator. The ventilator helps assist get enough oxygen to the lungs. Now, some people can survive that and come out of it. And it's those people that, yes, they can have long-term consequences, like you're asking, of having scar tissue where they would have difficulty breathing for a number of years after being extubated, after coming off the ventilator.
Okay.
The concerning thing, I just want to say, the concerning thing about this coronavirus, which is why we're taking all these precautions, is there is a small percent of healthy people, young and old, who are healthy, who end up in that situation where they need a ventilator. So it's because we can't tell which patients of those are going to end up on a ventilator. That's what is causing the most concern with this virus.
Okay. Yeah. Can you hear me? Hello? Okay. So I heard the incubation is one of the riskiest procedure because it can spread, the virus from the patient to the, the healthcare provider. What do you think about that?
Yeah. So there's a ventilation called positive pressure, where they put a mask and they help the patient breathe. That type of assistance is the worst thing that a healthcare worker can do, because it's gonna spread the virus all over the room, and the doctors, healthcare workers will get infected. So we don't even use that anymore.
Okay.
Incubation, as long as it's under control and they're wearing their PPEs, it's safe. They can safely do it. So we don't use that other one anymore. We use high flow oxygen, which is just oxygen they put into the nose. This is before they require a ventilator. But we take precaution not to use the other method.
I can't hear you, doctor, at all.
Can you hear me now? I
can't hear anything.
Can you hear me, Dr. Haddad?
I hear you. Sandra, are you with us?
Yes, I hear you.
I think we just can't hear Hanan.
We can't hear her.
Can you
very
hear me?
well.
I can't hear anything.
Okay, I think, is this better? I
can't hear you.
Okay, we can type. Let me tell her that we can hear each other, but we can't hear her.
Yeah, I think she's gonna come back. Sandra.
Yes.
Tell us a little bit more, so people who are watching, being pregnant, like from 1 to 10, how bad do you feel?
Right now, I'm probably about a 6.
Okay. And do you feel like you got enough information to deal with it?
Yes.
Okay. And you're isolating yourself from other people, correct?
Yes.
Okay. And who's helping you get your food, get your vitamins, get all that?
My sister, she lives right next door. My other sister, she lives next door.
I know it would be a rough couple of weeks, but I think, Dr. Belal, you think what, 10 to 11 days, you start having better symptoms after that?
That's correct. So Sandra, when was the first day that you started to have symptoms? How long has it been?
I think it was like Wednesday night, Thursday night. I started to get that itchy throat feeling.
Okay, so that's about a week ago.
Mm-hmm.
So you're about like day 7 now. You're halfway through getting over this infection. That's great. You're doing great.
Thank you.
And this is what we want people to know, that a lot of people are like Sandra, not like what you hear on the news.
Right. So on the news, you probably hear you're going to see all the very sick patients that go to the hospital and end up on ventilators. But 80% are people who can stay at home and do well. And the 20% we hear about, and it's very significant too, that there are people that, the 20% is a large number of patients. However, with social distancing, again, we can reduce that number. And can you hear us now? I don't think she can hear us.
It's going back and forth.
All right, so we can go on. So we can talk about. She wanted to talk about. We talked about the masks. Let's see.
So, for example, for Sandra, regarding the mask, she can wear the mask if she goes outside, but we don't recommend she goes outside for at least 14 days.
Correct.
But if you have to go outside to take a walk, don't be close to people. Wear your mask, wear your gloves, take them off if when you come home, because you don't want people like your sister coming home and touching what you touch, and then, for example, she gets it. But don't forget, if the area is fine and you can go walk around and there is not too many people and it's very good for your health. It boosts your immunity. It puts you in a better mood.
Okay.
Yeah, so I recommend also, if you do get the COVID-19 infection, is to remain in quarantine 14 days. And then when those 14 days are up, count how many days you've had no symptoms. So how many days have you not had a fever or not had a cough or not had difficulty breathing? If you've had 3 days of no symptoms, then you're free to unquarantine yourself, although we still have the shelter in place. But if you're still on day 14 still have symptoms, then you have to wait 3 more days without symptoms before you can get out of quarantine.
And I want people to know that, for example, Sandra, after you're done with all this, if you go to the store, you have to protect your hands, right? Because if you touch the virus somewhere and you bring it with you somewhere else, even you're protected, you can infect other people. So This is, people are not thinking, oh, I have the corona, then I can do things freely. I don't think it's going to be the case.
Mm-hmm.
Sorry about the connection. I lost you. I couldn't hear anything. But we have some questions from the viewers. Muhammad, do you gentlemen think the governor will extend the stay home, stay safe order at the end of April? What do you think?
So like we were talking earlier, the stay-at-home order has worked. The number of cases, we've reached peak, and we're starting to flatten that curve. It's all going to depend what happens at the end of April. If those numbers come down significantly to where the new infections are at a very low rate, then I think the governor may consider, and she'll get advice from her medical director, obviously, to open up little by little, some non-essential elements of society. But if it looks like, and then she might observe for a couple of weeks. If we spike, we get a whole bunch of new infections. She may again decide we're going to lock down again. So again, if everyone follows social distancing, especially when we're out of the lockdown, if you follow social distancing and you follow good hand hygiene and wear a mask, we can keep that number down where the healthcare system can handle the number of cases we're getting.
Okay. Before I ask you the question, Dr. Chadi, they want your phone number. Okay.
Well, they can contact you. You can give them my number. If I
okay, well,
Sandra has my number.
Okay, Sandra will give him the number.
The thing is, people have to be smart when this like easing up things. They have to be smart. I mean, I don't think people are gonna be comfortable going to the restaurant and hanging out. I think they're gonna. I think most people are gonna be very careful about how they're gonna reintroduce themselves to the society. It is scary, and we don't know, right? Every day something. I don't know. Maybe in June, if the weather is more, we might not see a lot of infection because people are outdoor and it's warmer. We don't know. Every day we get a new information. But I just want to be positive, thinking that when people are outdoor, right, you have less infection, respiratory. Like in the winter, you have flu. In the summer, you have less. I'm hoping it's the same thing that's going to happen. And just be positive, and things won't be this. It's not going to stay like today. It's going to get better for sure.
We definitely have to be positive about this for sure, Dr. Chadi. And Dr. Belal, as a Chief Medical Officer for long-term care at Beaumont Hospital in Dearborn, what is the situation like at the hospital?
So actually, again, it goes back to this shelter in place, which has done very well. At first, we thought of the worst, that this is going to get really bad. We're going to run out of ventilators. We're not going to have enough equipment, personal protective equipment to handle the situation. But the orders by the governor have really helped the hospitals. So we've been very successful. A lot of patients have been treated and discharged home, full recovery. Yes, we've had deaths, unfortunately. Again, it's the elderly with comorbid conditions. We've had some healthy young patients get really sick and go on a ventilator and recover. We've had a doctor that went through that. So it's been really, really well. We've done really well, and thank God, just because everybody really followed the social distancing. And
so you don't have any shortages of supplies, anything like that at the moment?
Fortunately, we are in good shape. We have not used up all our ventilators. We don't have to decide who's going to get a ventilator and who's not. We're not in that situation. We have ventilators still, waiting for new patients, and hopefully we won't get them. But we are in good shape right now.
And as far as the Arab Americans, I mean, Beaumont is in the heart of the community. Do you have a lot of cases of Arab Americans?
Well, so with Arab Americans, it's like any other ethnic community. The virus does not discriminate. It's going to go into anyone that decided not to social distance themselves.
Yes.
And the Arab Americans, we have in our community a lot of, unfortunately, we have a lot of people who smoke. We have a lot of people with diabetes and obesity and hypertension. So they're at risk. We don't have a spike just because somebody's Arab American or not. So it's been actually not too bad with the Arab Americans. And I can say they've been doing a good job. When the governor gave the order, they listened. And, you might see on the statistics that Dearborn has a high rate. But again, we have hospitals in Dearborn that are not all Arab Americans. So, but everyone is at risk, whether you're Arab American or not. And again,
you have like big number. You don't have a big number of cases, right?
Correct.
Okay.
Yeah.
I can also. I'm the chair of OB at Garden and on the board at Garden City Hospital, and I go to Oco, but it's a smaller hospital, and we have enough. We have extra ventilators, so we're seeing less cases the last few days, but things are looking, in the right direction. But like I said, we don't have to decide. How the news was, like we have to decide who's going to live, who's going to die. It's not the case anymore. We have enough ventilators, and I think medicine has changed. Every day there is new information, and doctors are very good about trying to help and save these patients. And some things are working, some things are not working, and we'll see when the studies come out what's good and what's not.
Absolutely. And doctors, what do you say to people who smoke hookah, narghile, and smokers? I mean, are they more susceptible to COVID-19?
I stopped smoking hookah. I'm taking vitamin C, vitamin D, and elderberry, and I think everybody should do that during those times.
Yeah, really, everyone should really, especially now, really consider, always try to quit smoking, whether it's hookah or cigarettes, just because you're putting yourself at risk. The virus loves to go into the lungs, and if your lungs are not at full capacity right now, then you're going to need every single cell in your lung. You're not going to be prepared for an infection if you're smoking.
Okay, good thing. As the pandemic spreads, and with the overwhelming number of patients, not necessarily here in the area, who needs ventilators, will doctors be forced to choose who lives and who doesn't? Or maybe they're already doing it. I don't know.
Yeah. So each hospital system has already put in place a sort of a protocol for how decisions are made. And they've also put along with the critical care physician who's taking care of the patient when it comes time to a ventilator, make a decision. But ethically, they have a committee that makes that decision, and it goes to the chief of staff. So there's a hierarchy of how the decision is made. So, and then there's an ethics committee. So there is a protocol in place already at most hospitals. So it's not up to me individually to decide who does or who doesn't, or Dr. Haddad, or it's a committee. There's an ethics committee, and there's a full protocol for determining. But it's in place, yes.
Yeah, and for our viewers, we always welcome your questions and comments, and we have, I think, a question here. Okay, again for Dr. Chadi.
I'm ready.
Okay. والغادة غملوش تحياتي لغادة بتقول تحياتي لدكتور شادي. And Lilian Salman, hi Dr. Abdallah. My question is they keep talking about opening up the country by May 1st. And if they do, I don't think people will take it seriously after that. And how can we ensure that?
So when they open up the country on May 1st, again, it's really simple, basic things. Social distancing, stay 6 feet or more away from everyone else that's not within your household. Wash your hands frequently. Do not touch your face if your hands are not washed. And wear a mask in public, especially if you're visiting a grocery store or a pharmacy. Now, if you can do that for the next several months and wait and be patient for a vaccine to come, then we're going to all be okay. And that's not very hard to do. We can go back to our normal lives. We just have to stay away from one another.
And I want to ask you, Sandra, any fears tonight? Do you feel any fear? Are you scared of anything at all?
No, not really.
So you're getting better, obviously. Yes. I mean, that's what you've been telling us.
Yes.
That's good. We have a question from Sarah Canso. If someone has skin I don't know how to say that.
Sarcoidosis?
Yeah, but not in lungs. Is it still considered high risk too?
Yeah, any illness can be a small risk. Skin sarcoidosis, not so much. If you don't have it in the lungs. So it would not be like diabetes or hypertension or heart disease or asthma. Yes. You're at less risk. Correct.
Okay. So I guess we're going to take a break right now. And after the break, our discussion will continue with the doctors. And we're going to talk about this groundbreaking new initiative that's happening right here in Michigan. So stay with us.
The One, we are business consultants who equip leaders to lead at their highest level while building teams that work together and support their team and the leadership. We deliver customized business solutions that fit your company's needs, including business development and customized process solutions. Contact us today. Thank you.
Welcome back. We're here again with Dr. Belal Abdallah and Dr. Chadi Haddad and patient Sandra Ramos, who is COVID-19 pregnant. So Dr. Belal, we're going to talk about the new initiative, the groundbreaking new initiative that's happening here in Michigan at Beaumont Health System. So trials have now gotten underway coast to coast, but the biggest one yet is here. So 38,000 workers across the hospital system have the chance to get tested now. What can you tell us about that and how does that work?
Okay, so this is the antibody test
right.
For the COVID-19. So we all, after we get an infection, we build antibodies against the virus. And there are two types of antibodies, IgM and IgG. IgM is the first antibody that your immune system builds up to fight the virus. And that usually comes within 5 to 7 days of the initial infection and can stay within your body fighting the infection for as long as a month. And then the IgG comes at a later time. It's another antibody. The IgG is long-term, and it stays with you for many, many years, even for the rest of your life, to fight the COVID-19 if it comes back to try to infect you again. So now what we're doing is we're testing the IgM and IgG antibodies in people who have had the infection, or sometimes people don't know they had the infection, and we can test them to see if they did have the infection by looking at IgM and IgG. So the study you mentioned in Beaumont is, yes, they're going to test 38,000, maybe even 40,000 people to see who's got IgG. So if you have IgG, that means you have the long-term antibody to fight the COVID-19. And these are the people that can actually donate their plasma to help other people who are infected or in severe shape. So that's the antibodies. So
are we unlocking the coronavirus by doing this? Maybe?
No, not really. I mean, this is when someone is immune. We can use the antibody to help those who are like very, very sick. But we can't keep up the pace of taking somebody's antibodies as a plasma donor and giving them to others who are not sick. We just can't keep pace with how the infection is going. The only truly way is to have a vaccine where we give someone something similar to the virus that causes them to develop these antibodies, and then they're immune.
Okay, so Dr. Chadi, is it really going to get people to work? I mean, with this, maybe?
If they have the antibody, you mean?
Yes.
Well, if you have the antibody, that means you have the infection, right? So you have a long-term immunity and a short-term immunity. We still don't know how long it's going to take for the long-term immunity. That's why Dr. Belal are doing the test and the study. But what happened to the person who we don't know anything about, that is going back home, and the worker that has his parents at home, they might be sick? It's going to be very tricky. Maybe you can do enough testing to see if somebody, enough people are negative, so you can bring them. It depends on the work that they do and kind of what company it is. Can you keep these people safe? I would like to say that things are going to be better soon or normal soon. I don't think so. I mean, even when we're talking about the virus, I don't think they're going to come out with the virus, very fast. For example, when they tried the dengue fever, right? What happened is you give somebody something very close or genetically close to the virus, and you have the body react to it. So when you get exposed, you make antibody. What they have realized when they did that, it just made things worse. You don't want to jump into a vaccine so fast that things can get worse when you get infected. I think we need to adjust how we're living. We need to accept it, and don't say, if you think you're going to go back to normal, you're going to stress yourself. Just accept the way things are. Let's see how the summer goes. Let the expert do the research. Let Dr. Bilal find a medication that works for us, and maybe we'll open things slowly. I love Dr. Bilal. We knew each other for a long time.
So there is no potential end to this pandemic by this. This is what
the antibodies? No, unfortunately, no. What it will help is when we do have a vaccine, is we know which people are the most vulnerable, and we will vaccinate them first. So if you don't have IgG, you'll be
hoping for that to happen soon, so to get on with our lives, because we're tired of just sitting home.
We have to get used to it. No, you might be able to go out and do things, but it's not going to be the same. I've read some report today. It can go up to 2024 before things really go back to normal. But we don't know, right? I might say this right now, but we don't know how things going to be, what the virus is going to do, what the study is going to show us. Every day we're getting new information. So just, be positive. Things will be better. It won't be the same right away. We just don't want to fool people. And I think when you accept that, you probably be happier than thinking, oh, I got to go back to the normal life. You're going to stress yourself. No, just accept that things will be a little bit different. Get used to it, adjust to it. And, I'm finding it's not too bad. So, you're spending more time with the family. You don't have to stress about work too much. You don't have to stress about which restaurant you want to go eat or what movie you're going to watch.
You think about it as it's a break. How about that?
Yeah. It could be a lifestyle that we get used to it, right?
Yes.
We didn't have iPhones we were okay. We have iPhones. We got used to them. Take it away now, it will be a shock. But if you get used to things slowly, I think we're gonna be okay and let things happen.
I think human beings they adjust well or easily. I think so.
Mm-hmm.
So
Yeah.
we have a question. Well, do we need to stay shut down 2 more months, in your opinion? Did we answer that or not yet?
I don't think it will be 2 months. It'll be easier, but it won't be the norm.
Yeah, yes. So, okay, I have a question about the hydroxychloroquine. Okay, there's a lot of debate. Now we have a clinical trial for that, and we know it treats malaria, it treats lupus, and it treats what else? It treats arthritis, right? It is. We have a clinical trial to evaluate the safety and effectiveness of this drug. But we heard recently that there is a fatal side effect to it, which is a sudden cardiac complications. Your thoughts about that?
Yeah, so let me start with the risks of hydroxychloroquine. The risk is someone can have a deadly arrhythmia suddenly, but we can determine which patients are at risk by doing an EKG, and looking at the EKG, we can determine which patients are at risk for that arrhythmia. And then we can do some things to help them alleviate from going into that arrhythmia also, just such as making sure their magnesium and potassium are all at good levels. So let me get into all these studies that are going on in the treatment.
Please.
So hydroxychloroquine, as you know, is an anti-malarial drug. It's been around for 100 years. It's manufactured in India, and they found across the world as this virus started spreading that some people who use hydroxychloroquine maybe did not get as sick as others. The studies that came out early were really not good studies, and that's why we do not go out and say hydroxychloroquine is the cure, because every study, as you know, as a scientific study, you have to have a control group, and that group has to be, you have to understand if people, if they take it, how do they do? If they don't take it, how do they do? And then you have to track them for a long period of time and get a large number of people to make it significant. So just 5 days ago, one study came out, the results came out, that patients who are in the hospital and they used hydroxychloroquine, and these patients were sick patients. So let me talk about the very sick ones. It did not make a difference whether they ended up in the ICU on a ventilator or died if they were on hydroxychloroquine. So that's not good news.
Okay.
But however, there are many other trials where, such as the one at Henry Ford Hospital, where they're studying if you gave hydroxychloroquine prophylactically, meaning give it to people who are not sick, who haven't been infected, and then they contract the virus. It doesn't prevent the virus from infecting you, but will it reduce the symptoms so that you don't get very sick? That might be promising. That one might show that if you took hydroxychloroquine on a regular basis, let's say once every week or once every 3 weeks, depending on how they did the study, will that reduce the severe infections? So we're looking at two parts. One part is looking at it very early before people get very sick, and that's promising, but we don't have a full result yet. The other part is the ones that are very sick and giving it to them at that point. We now know that that's not really that significantly helping at that point. So there's still some promise to hydroxychloroquine, and there is a way we can fight the risk and defend against the risk. So there's still promise to that drug. And, President Trump pushes hydroxychloroquine.
Yes.
But it has not been proven. So until it's proven, you're not going to see it on the CDC. You're not going to see me talk about it or Dr. Haddad talk about it. We might mention it, but we're not going to say go ahead and take it.
Yes.
Yeah, it's funny because I had 2 consults with 2 infectious disease. One did not want to treat the patient, and one wanted to treat the patient.
Yes.
Right? Yeah. So I in a way I don't want to be prescribing it because we don't know. So I'm leaving it to the expert in infectious disease. It is a safe medication in pregnancy. It does not cause harm to the baby. That's one thing we need to talk about.
While they're pregnant, they can take it.
Yes, It is safe in pregnancy. Even this and the Z-Pack is safe in pregnancy. So those two medication, if they want to use them in pregnant women, it's totally fine. They don't cause any harm and they don't cause malformation on the baby. But now infectious disease, they have two different opinions. Why? Because we don't have enough information. We don't have enough studies. One thing that is very concerning is, it's showing so many symptoms and every patient is reacting different to the virus. We've had people with skin problems. We had people with, like shortness of breath, but we had people with pain on their skin or headaches that is not the usual one. So we don't know, or how do you have some patients that don't smell or taste, right? So the virus is working in different area of the bodies. So maybe the hydroxy will work on some patients, but maybe it won't work on other patients.
Yeah.
So all, information is going to be coming.
Yeah, but we're always worried about side effects. And, Tom Hanks' wife, Rita, last night she came out and said that she was treated with hydroxychloroquine and she got really bad side effects like diarrhea and vertigo, and she couldn't even move from the treatment. So that's, that's very...
Yeah, but that's one patient, right? But if you consider everybody else who are doing well, then you have to sort that information and find out. But for pregnant lady like Sandra, if your infectious disease doc said you need that medication, she can take it.
Yes. So what happens when the medication that you rely on becomes a high commodity? That's for both of you.
Yeah. So as I mentioned, it's manufactured in India. Now, if the studies come out, especially this prophylactic study, and shows that, yes, if you use hydroxychloroquine, you're not going to get a bad illness, you're not going to get the bad consequences like respiratory failure, it's going to become a hot commodity, right?
Yes.
So at that point, you're going to get the whole world looking at India, start manufacturing this drug 24/7. But I think the world will come together and we will be able to produce these drugs almost, for everyone and more, and then some. So I don't.
Then we'll shift. Then we'll shift GDP from China to India.
So they're saying there is a fear of second wave of the virus. What do you say about that?
Yeah. So right now, we got the first wave of infections, and we all learned our lesson. I think every one of us now understands social distancing. And we're going to all prevent ourselves from getting infected, obviously. The second wave, and like Dr. Haddad mentioned earlier, in the summertime, many of us will not be confined to closed places. And so we'll be out in the open. And the flu season doesn't come until September, October. That's when the second wave may come, is during the flu season in the fall. Mm-hmm. So it's going to become colder. People are going to become more confined. And the problem is we may be at more risk of flu and COVID-19 at that point. However, again, it goes back to what we've learned from social distancing and good hand hygiene and wearing masks. We may help ourselves from catching the flu even more now, because now we're social distancing and we do have a flu vaccine, so we can all take the flu vaccine. And I recommend everyone to take the flu vaccine this year.
Including pregnant women.
Yes, everyone, children and elderly and young, and those who don't smoke and those who smoke.
Yeah, I've never taken the flu shots in my life. I'm going to consider this year for sure.
Yeah, you should.
So the expectations for, you're talking summer and fall, what's going to happen?
So when the fall comes and we get that second wave with the flu season, people are going to, and I don't want anyone to panic. People are going to be anxious about, do I have COVID? Do I have the flu? But I think we're much, much more prepared now, because now we have testing that'll be available right away. We'll have the IgG, IgM antibodies testing. We'll be able to, definitely we can find out whether it's flu or COVID-19 within a couple of hours. So we'll be better prepared. We'll be fine.
And also we would know how many people hopefully got infected, right? Or people who had no symptoms and didn't know they were infected. We would know the numbers. And then these people will find out if they have protection or not, correct? Because we don't know the long-term protection of this against this virus. Now, my recommendation gonna be exactly the same thing. You want to protect so you don't have tragedy on your family instead of having statistics. So in the fall, Sandra and me and Dr. Bilal, we're gonna be very careful going to our parents, the kids going to their grandparents. Make sure we're clean, we're sanitizing. Make this visit short if we have any symptoms of any sort, because this virus is really weird. I'm telling you, you'll have. I have somebody who told me that they had slight headache on the right side, and it was unusual, more on a skin kind of thing than inside, and they tested positive. So if you have any symptoms, I think you should use precaution in this coming winter to see how to find out what's going on and how the virus is going to react.
Sure. I have a question from Nuno Bezde. What about the 1-year-old? Can they take the shot?
Who?
She's asking, what about
the flu shot?
Yeah, the flu shot. Yeah, they can take the shot if they're 1-year-old.
I'm not a pediatrician, but I know that my children who are young have been getting the flu vaccine every year. I don't know if they started at 1 year, but I believe yes. But I would ask that question to the pediatrician.
Okay. We want to thank Huda Danawi. She's saying hi to you guys. And we have a few people. Thank you really for watching and following the WhatsApp Media Network and following the program. And we hope, what are you going to do, Dr. Bilal? The first thing that you want to do when the quarantine is over?
When the quarantine is over, I think I want to go to, we have a place in Florida. I was supposed to be there last week. I think the first thing I'm going to do is go to the beach. Okay.
What about Dr. Chadi?
Me? I'm going to stay in quarantines. This way nobody asks me for any favors in my family. I'm enjoying it.
From what we know now, you're happy. You're enjoying this, huh?
Yeah, heck, nobody asked for any favors.
Well, that's good. Sandra, I hope you feel better. Thank you really for joining us tonight. We appreciate you. And you're going to be better for sure. And that's an assurance probably from Dr. Chadi as well. You're his patient.
Yes.
He will take care of you for sure. And we want to thank all of you for being here and answering all these questions. We appreciate you a lot, doctors. And thank you, Sandra, again. And thank you for our viewers.
And people can find us. We're in the community. We're on Facebook. Yes. They can send us messages. We'll be more than happy to ease their stress and talk to them about their fears. I know everybody is scared. Yes. Don't be scared. It's going to be all right. And we'll get through it. And just protect the people who are weak and the older people. That's all you have to do for now.
Any final thoughts, Dr. Bilal?
Well, first I want to thank you, Hanan, for a great show and great questions. And you're really helping the community out there with what you're doing. And just for everyone, what we've learned now is we have to be careful around others, social distancing, good hand hygiene, and wear a mask. We're all going to we're in it together. We're going to be all okay. It's going to go back to maybe not the pre-pandemic normal, but we will go back to normal very soon.
We hope so. And Sandra, what would you like to say to pregnant women out there?
Just try and be safe. Wear a mask, gloves, make sure you're washing your hands, and stay away from people. It'll be all right.
That's good. Very good advice. You can't go wrong with that. Thank you so much. And please, for our viewers, please stay home and stay safe. Thank you and have a good
night.
Thank you.
دمتم دائما بخير وإلى اللقاء. Thank you.
Thank you.